Hello, and thanks for tuning in to Town Meeting TV's ongoing coverage of General Election 2024. My name is Meghan O'Rourke, and I will be hosting tonight's forum. This is part of a series of candidate forums that we're hosting, and you can find out more by going to cctv.org/general. You can also find us on our YouTube channel at youtube.com/Town Meeting TV. On tonight's program, we are going to hear from the candidates running in Chittenden 13 district. These are 2 seats and they are uncontested, and we have with us tonight incumbent Tiff Bluemle, who has served already in the House for how many terms?
2 terms.
2 terms, and Bram Kleppner, who is will be a freshman. I think they call it a freshman representative come November or come January. And welcome. Thanks for joining us. We have prepared a list of questions for the candidates, and we'll read through those. But the phones are open if you want to call in at 802-862-3966. And we'll start with opening statements, and we're going to start with you, Tiff, as the incumbent. And in your opening statement, just tell us what qualifies you to run, to be elected. And if you could also give the boundaries of your district.
Sure.
Maybe a little bit of how folks can get in touch with you. And if you could also tell us what committee you served on. I know that's a lot to say in one opening statement, but
I will do my very best.
Thanks.
We are our district is the south end of Burlington. It kind of jigs and jogs around the Spruce, Maple, Cliff Street area, goes directly up the hill and then south along South Prospect and goes as far as Home Avenue and down to Oakledge Park and South Cove area. So did I do a good job in describing that?
Yes, you did.
Okay, thank you.
And you share the same district, so you can
we share the same district.
door
exactly.
knocking together.
Well, we did not because there were 4 people running the primary,
That's right,
but we sure will now.
Yes.
First, thanks for doing this. This is, I kind of rely on CCTV to keep me aware of what's happening locally when we are kind of thinking, when we're ensconced in the State House. It's really an invaluable resource. So support CCTV. I'm a teacher. I taught for a number of years. I'm a mom. I was a nonprofit leader and an advocate for women, women's economic opportunity and gender equity. Worked with Bram actually in a project in the past. I was motivated to run 4 years ago because all of a sudden people were starting to talk about issues that I'd been talking about for a long time, and others had too. But they just never really got any traction. But like, for example, the importance of childcare or paid family leave or access to health care, all of those things, I guess I saw this opportunity when our 2 representatives decided to retire. Maybe I'd like to be on the other side of the table. I've helped to make investments in housing, reform aspects of the child abuse substantiation process, and help to advocate for new investments in recovery housing and disability housing. I serve as a member of the Appropriations Committee. And we build the state budget, and in that capacity I work with several different committees to help inform the work we do to decide what to appropriate as it relates to housing, as it relates to substance use, as it relates to mental health, and the legislative budget. And in that capacity, I find I'm not just interested in policy, but then I'm also interested in what happens after we adjourn. And I try to follow things afterwards to see what's getting appropriated, what RFPs are going out based on the appropriations we made. And so serving on House appropriations, it's not just about making decisions about funding, but it's also about evaluating whether the money that we are spending is making a difference, and whether we're leaving federal dollars on the table, and whether we're giving state agencies employees the tools that they need and resources that they need to do what we have asked them to do. So I've learned a lot in 4 years. I continue to be engaged in the issues that took me there, and I'm really grateful to have a chance to serve again.
Great, thanks so much. Bram Kleppner, to you.
Thank you. I've had an intertwined business and policy career. I spent 10 years at Ben & Jerry's, mostly doing international business development, and co-led Ben & Jerry's first anti-global warming campaign. And after that, I spent 17 years at Danforth Pewter, 13 as CEO, and spent time in the State House talking about the burden that our health care system was putting on small businesses and our employees. And I think that work and willingness and desire to work on healthcare reform from the business side caused Governor Shumlin to appoint me to his Business Advisory Council on Healthcare Financing, which led to an invitation to co-chair Vermont's Medicaid and Exchange Advisory Board as we were launching the Obamacare exchange and combining Medicaid and the exchange. And I also served for 2 years as a member of the Vermont Tax Structure Commission. I was the only kind of non-tax professional in one way or another on that 3-member commission, charged by the legislature to make recommendations to make Vermont's tax system fairer, simpler, and more sustainable. And we will get back to where that work stands today. And at Danforth Pewter, the 13 years I was CEO there, did some of the gender equity work that Tiff mentioned. We did manage to institute partially paid maternity leave. And we also did climate work. We put the company on the path to zero fossil fuel use. We built a solar farm, and we put in heat pumps and a charging station for employees and customers to use. And I think based on that work, Speaker Krowinski appointed me to the Vermont Climate Council, where we have been working diligently ever since. And I wasn't particularly planning on running for office, but our very highly regarded representative, Gabrielle Stebbins, decided not to run for re-election. And I had a friendly working relationship with her, and she encouraged me to run, and it was too nice an invitation to say no to. So here we are. And
here you are. And if you have a choice of committee assignment, what committee would you want to take part in at this point?
I think, as I said, I have background in healthcare, so the healthcare committee would make sense. I've spent a lot of time on energy and environment, and that's also where Representative Stebbins sat, so that would also make sense. And although it is somewhat presumptuous for a first-year member to aspire to a money committee, I do think the fact that I have run a mid-sized manufacturing business in Vermont and served on the Tax Structure Commission. It would not be crazy were the Speaker to decide I could be helpful on the Ways and Means Committee, which is the House Tax Policy Committee, particularly as we grapple with the issue of property taxes and education spending.
Yeah. Well, let's jump into the questions that we have prepared, and we can see how far we get. So, public safety and criminal justice. Public safety is a top priority for many voters in this election. This past session, lawmakers increased judicial staff, increased retail theft penalties, and expanded restorative justice practices in Vermont. What more needs to be done by the legislature to advance public safety and repair Vermont's criminal justice system? And we will, I'm going to start with you, Bram, on this, and
Sure.
Your thoughts on this.
Sure. Well, you're absolutely right. Public safety is top of mind for the number one issue for a lot of people in our district. I mean, we heard it loud and clear as we were knocking on doors during the primary, and every day since. You're also absolutely right. The legislature took some important steps in terms of allocating more money for more judges and for public defenders and their staffs to work through the backlog. I think Burlington is making progress on hiring more uniformed officers, and the budget includes another 10 uniformed officers, which will be helpful. But as I talk to people who work in the world of addiction and mental health, fentanyl is qualitatively different from the heroin epidemic that we had in the past, and we all feel it. We had a heroin problem, but it felt like we were managing it, and now it feels like it has become unmanageable. And my understanding of that particular addiction, and as we've discussed, 90+% of the overdose deaths involve fentanyl in the city. So that sort of addiction, really the more or less the only path to recovery is to be physically separated from access to the drugs. I was in a meeting with the police chief who said, if you are using fentanyl, the thing you are most afraid of in the world is withdrawal. More than you're afraid of arrest, more than you're afraid of getting beaten up if you try to steal something. So I think we need to get to a point where if people are using drugs in public or shoplifting to support their habit or dealing to support their habit, we need to get to a point where we can offer them a choice of either going into a locked rehab facility or going into the criminal justice system.
Great, thanks. And we do have a question on overdose crisis as well. Tiff Bluemle on the question of public safety and criminal justice.
So hard, to talk about public safety without doing, what Bram has done to talk about fentanyl addiction and its impact on the people who are addicted, and how that has changed really the landscape, or mental health. And both substance use and mental health are part of my budget dockets. And as you said, we've made some really important investments this year that will help expedite cases through the criminal justice system. But they only got half of what they needed. And we are going to have a choice again about trying to meet the needs that we had identified last year, to kind of make up that difference. I think in the coming session, I think Bram said a lot of it really well, and I agree with most everything. I'm not sure that I agree with the last statement about incarceration versus forced treatment. I need to talk with more people about that, about the effectiveness of forced treatment, because I know that in prison, treatment is, there really isn't treatment in prison. There is kind of management of addiction through buprenorphine. Or I think we can make it easier for people to have access to buprenorphine. Oh, okay.
No, keep going. Finish up.
Okay.
Sorry, I didn't mean to
Hurry.
Yeah.
Speed it along. I think that there is a 28-day, long-acting dose that makes perfect sense for folks who are transitioning out of prison, who really are hard-pressed to have transportation to and from treatment, with all the other obligations that they have to meet. And maybe we're on the track to making that possible. I think that Bram and I have been in conversation with people. I think that our delegation is very committed to keeping guns out of bars and restaurants that serve alcohol. And I think we need to invest way more in residential and mobile mental health.
Great, thanks. So, and apologies for moving you along. We do have a lot of questions. We do have a question on the overdose crisis. I mean, one thing that I'm hearing is this relationship between mental health and and illegal drug use, or what is considered illegal drug use. And we're here on this overdose crisis. What can be done, what must be done to prevent overdoses, promote addiction recovery, and deter the illegal sale of opioids in Vermont?
Well, the legislature has kind of approached this as a three-legged stool. So we need to invest in prevention and treatment and in recovery. And recovery has kind of gotten the short end of the stick all the time. And this year we made some real improvement in investing in stabilization beds. When people relapse, there's some place for them to go. We invested $1 million in that, and in recovery beds, recovery housing, where people can, once they leave treatment. I think that we need to think about longer treatment for those who need it. It's not necessarily appropriate for everybody, but there are a number of providers who have said to me, why 2 weeks only? And I think I think that engaging peers, people who have been addicted and now are in recovery, in the actual work with folks in addiction and recognizing their value and paying them and certifying them so that they could actually bill Medicaid, that will help. Finally, I think we need to get the money out more quickly. The opioid settlement fund has languished in certain ways at the Department of Health, and we need to speed up the process of getting the money out the door.
Is that something the legislature can do? Can have an effect?
We don't implement,
Yeah.
but we certainly can ask questions. From the moment that we appropriate the money and leave, and I will be doing that in a couple weeks.
Thanks. And Bram, on the question of overdose crisis.
Yes, I supported the safe injection site in Burlington. I think it's important for people to understand what safe injection sites can and cannot do. What they are really good at is preventing overdose deaths. And they are also really helpful at keeping people out of the emergency room. So you free up emergency room resources for other health needs. It's a little bit easier to get someone into rehab from a safe injection site than from the street or from an encampment, but not immensely so. So, they're there to save lives and keep people out of the ER, and they do that really well. I was talking to a woman who has worked on the front lines of addiction for 30 years, both here and in New York City, and, asked her how, once someone's addicted, you have treatment and rehab, and these things are really hard, and there's a great physical and mental toll. How do you disrupt that before it starts? How do you get people to not try it the first time? And what she said was, most people who use the first time and then become addicted have suffered trauma in their lives of one sort or another, physical, emotional, sexual. They have suffered trauma, and often it's that, and there is addiction in the house they grew up in, whether it was heroin or alcohol or whatever it happened to be. I think recognizing the role that how many of us are damaged by trauma and how little of that gets treated effectively so that people can really heal and move beyond it is an important component of dealing with the opioid crisis. I also think that people who are bringing drugs into our state and selling them and using the money to buy guns, which they then export, we have seen them on the street. It feels to me, and I've never worked in policing, so I don't know, but it feels like it should not be that hard to get those people into the criminal justice system.
Thanks. I'm going to jump, hopefully the control booth won't be too upset with me. I'm going to jump to the question on emergency shelter, since that's something that's happening right now and kind of related to this. So Vermont reported 3,295 people experiencing homelessness in 2023, up from, and those numbers are probably larger now, and we're just about to end the motel program as it's the emergency housing program. Today I saw press release from the mayor asking for people to donate tents and to open up their housing spaces. What is the legislature going to do this upcoming year to meet emergency housing? And what are you all going to do in your roles to meet emergency housing needs across the state? And I'm going to start with you, Bram, on this. And we only have 10 minutes left, so if we can get through a couple more questions, we're going to be like, great.
This will be a very short answer because I really don't know enough about emergency housing in terms of what's available and where the funding comes from. So I really am looking to learn about that, and am very grateful that my partner from our district is someone who's very knowledgeable about housing.
Yeah. Tiff.
The emergency housing policy that we passed was a compromise with the Senate and the administration. And we were able to develop, to dedicate $88 million to supporting people in temporary housing and paying for the actual rooms, and to expand emergency shelter. And for that to last through the year, we had to agree to, so that we could house people in the winter, we had to agree to an 80-day cap. And it is really hard to see. I'm in regular contact with providers to understand what they need, and we have spent a lot of money on emergency housing, and it doesn't help contribute to our housing stock. And so the legislature is faced with this, we can appropriate, and go back to what I said before, is that like we're not the implementers, and we have asked the administration to take the lead in developing the policy and how it is going to expand the shelter capacity. We dedicated $17 million to that. To my knowledge, very little has been done to date. And we have until December 1, when the emergency housing then opens up again for all the groups who are eligible because of winter weather. So I have said to everybody I know, you need to contact the governor and the administration, because the legislature can't control the speed with which an administration acts on policy. And I think people at DCF are working hard. And I think that this has not been a priority for the governor. And it has hit Burlington particularly, and Rutland, and Brattleboro very, very hard.
Yeah. Do we have time for another question? I'm looking at the booth. Yeah, one question. I'm going to jump back to healthcare then. So one of the primary drivers in rising school budgets and affordability issues in Vermont is the increasing cost of health insurance. What can we do in the state to reduce the cost of healthcare and meet healthcare needs of every Vermonter? And we'll start with you, Tiff.
Well, I'm really interested to dig into the report that's been put out by the consultant to the Green Mountain Care Board. It appears that the current hospital system as we have it is not sustainable, and is actually at great risk of failing. So that's one thing we need to resolve, and that probably addressing those needs probably is going to lead to some kind of consolidation, restructuring of sorts.
Nervous.
And that makes people very, understandably.
Yeah.
And the auditor has proposed that we could save money through reference-based pricing. So why are we paying a lot more for a colonoscopy here in Chittenden County than we would in Rutland, or than we would in Brattleboro? That, I think, is something that other states have done, and I don't know how much money they have saved and how that's made a difference. I don't know anything about insurance costs. I have to say that I'm trying to keep a pace of what the healthcare committee is wrestling with, but it's complicated enough that I don't know insurance very well. Workforce issues. I mean, I think there are stressors on our healthcare system that relate to not enough people in the workforce. We just went to the Vermont Medical Society event this week, and I talked to students, medical students, and asked them very directly, are you thinking about moving here, staying here once your residency is over? Or you're done with med school? And they said, well, if I can afford it, if I can get paid enough,
Yeah.
and we have to bolster our workforce in those areas to meet the healthcare needs of people in Vermont. So how's that for a non-answer?
Great. Well, there you go. Bram, do you have thoughts on this?
I do. On reference-based pricing, other states, which are larger than we are, have saved tens of millions of dollars a year. We can certainly save millions, which, single-digit millions isn't huge in the context of a $6 billion health spend, but
Can you just explain reference-based pricing real quick? Thanks.
It's what Tiff said, that you set a price for a thoracic CAT scan, and all the hospitals charge that price.
Got it. Thanks. I gleaned that, but I wanted to confirm.
I don't think I was that.
It was good.
Yes,
You're great.
absolutely. I sort of do a very simple business analysis on this question. You look at healthcare systems in rich countries around the world and ask three sort of very simple questions. How good are they at their job, which is keeping people healthy and returning people to health once they get sick or banged up? 2, how much does it cost per person? And 3, what % of the population does the system serve? And we lose on all 3. No country has a perfect healthcare system, but there are a bunch that are a lot better than ours. And we can simply take the best of the systems around the world and restructure ours from the ground up. And
can we do that in Vermont? Or do we have to do that on a nationwide?
It would be really helpful if we did it nationally, but that is vanishingly unlikely to happen. And we can do it. We can do it on a Vermont level. Under Governor Shumlin, we didn't get within reach, but I'd say we got within sight. Like, we could see it. We could see how it could work. So
Great.
I think ultimately the way to manage costs is to move to a statewide single-payer system.
Great. Thanks. I am going to take a few minutes to do the lightning round because we really like this, and we'll go back and forth. Bram, do you support a statewide ban on assault weapons?
Yes.
Yes.
Should legislators be paid more?
Yes, for diversity.
Yes.
Great.
Should Vermont have publicly financed elections?
I don't know enough about where the money would come from.
I don't know enough yet about that.
Great.
In principle, yeah.
Would you support just cause eviction, a charter change to support just cause evictions?
Well, regardless of how I feel, I actually support just cause eviction. But regardless of how I would feel about it, the Burlington voters voted for it. And so as their representative, I think I would need to.
Got it.
It's a little too nuanced for a yes or no, but I absolutely agree with Tiff and with the general principle that Montpelier should not have a veto over a city's decision to change its charter.
Great, thanks. Do you support banning or limiting cell phone use in schools?
Yes.
Yes.
From parents. Straight, that was really fast. What was the first political campaign you worked on?
I worked on the Mondale campaign after I graduated from college.
Great.
I worked on Howard Dean's presidential campaign.
Well, what's a small business in Vermont that you frequent?
We had all our campaign stuff printed at Paw Prints and at First Step.
Okay,
Shy Guy, Outdoor Gear Exchange, Danform Shoes,
got it.
Phoenix Books,
Flying Pig.
And
Danforth Pewter.
who are you supporting in the presidential election?
Kamala.
And that seemed like it was rehearsed. Fantastic. All right. Well, thank you both for being here. We have 30 seconds each if you want to just let folks know how they can get in touch with you, and if there's anything that you just need to say, now is the time to do it. And we'll start with you, Bram.
Sure. My campaign website is bramvt.com, BRAMVT.com, and you can contact me through there with any questions, and I will be more than happy to respond to you.
And my campaign website is tiffbluemle.com. I also have a presence on the legislative page, and can be reached either through the Tiff at tiffbluemle.com or the legislative address, which is on the legislative pages.
Great. Thanks so much. Thank you all for tuning in to Town Meeting TV's ongoing coverage of local candidates, local ballot items, and local budgets. You can find this, well, the local budgets we'll vote on in March. You can find this and more at cctv.org/general. And don't forget to vote on or before November 5th. And then you can tune in on election night here, and we'll be bringing you results in the elections in our Chittenden County area, as well as commentary on the national elections. And thanks for watching.